important and human health. We need aware of the complex extents that binds us to our environment. We have already started noticing the difference in our health and how it is related to what we do our environment. However, a point to consider is that if a bad environment can use harm to human health, a good environment can actually nurture it. Unhealthy environment, unhealthy life. A report jointly published by the United Nations Environment Programme, the WHO, the Montreal Protocol on Substances that deplete the ozone layer, the Convention on Biological Diversity, and the Stockholm, Rotterdam, and Basel Conventions that state that in year 2012 alone, approximately 12.6 million people lost their lives due to conditions brought on by environmental pollution. UNEP also estimates that environmental degradation is behind 25% of all human diseases. Environmental pollution impact. While environmental pollution may have an impact on everyone, research has shown that there are certain demographics that are more vulnerable to its effect: the young, the poor, women, the migrant workers, and the elderly. In addition, diseases such as Ebola, Zika, and SARS are emerging every few months and spreading because of overpopulation, too much livestock, and the resultant environmental impact. In order to stop the spread of these diseases, health ecosystems are essential. While tackling these diseases, such ecosystem can also bring about economic development, reduction of poverty, fewer risks to human well-being, and the security of knowing that resources will not run out. Mental health. Increasingly, studies conducted on mental health are relating good mental health with exposure to nature. These studies have linked reduction of the symptoms of anxiety and depression and lowered stress level to the presence of green space close by. In fact, people who move to urban areas that are greener were seen to have improved mental health. Water contamination impact. This is another example of environmental pollution affecting those in the lower economic strata. In countries where the economic level are middle to low, availability to clean water is responsible for 58% of the diarrhea cases. Contaminated water and poor hygiene and sanitation are responsible for the death of around 3.5 million people. They also cause the premature deaths of around 25% of children younger than 40 years of age. Approach to resolution. There are several areas of immediate concern based on the connection between poor human health and environmental degradation. Some of them are ecosystems that have degraded and natural systems on earth that are under pressure, which are more likely to cause disasters such as diseases, outbreak, scarcity of food, and cultural disaster. Insufficient sanitation, poor hygiene, and unsafe water that are the cause of healthy diseases. Poor mental health and even its economic productivity badly. Poor nutrition combined with dropping level of physical activity leading to the spread of non-communicable diseases. Conclusion. Directly or indirectly, a health environment means a health people. This is not to say that diseases and malnutrition will be eliminated entirely, with the incidence of these occurrences will reduce and millions of human lives will not be lost every year.